Hello, I'm Dr. Margaret Ellis, a physician specializing in senior health with more than 25 years of experience in geriatrics and integrative medicine. Did you know that the way you sleep may be directly related to memory loss after age 60? It may sound strange, but science confirms it. Your sleeping position affects how the brain cleans and protects itself during the night. And if this cleansing doesn't happen as it should, toxins build up. Memory fails, and the risk of dementia increases. Maybe you've noticed that you forget names, dates, or where you left your glasses. It may seem normal with age, but what if it's partly triggered by another factor? By the way, how do you sleep each night? In this video, I'll explain. What is the sleeping position that could erase your memory? And most importantly, what is the correct position to protect your brain and preserve your independence and quality of life? I'll share stories from real patients, explain what science has discovered in simple terms, and give you practical, no-fuss guidance. So get ready to change small habits that can save your memory, your mental health, and even your independence. Comment below whether you usually sleep on your side, on your back, or on your stomach. Like the video, share it with someone you love, and subscribe to the channel for more content like this. Let's begin. Have you ever stopped to think that something as simple as your sleeping position could directly affect your brain? Many patients tell me, Doctor, Margaret, I sleep well, but my memory is getting worse. Could it be my age? And of course, aging brings natural changes. But in many cases, the problem is not just age. It's how the brain is cared for during sleep. At night, our brain performs a vital function. It literally cleans itself, like a house at the end of the day, sweeping away the toxins accumulated during wakefulness. This cleansing is essential to preserve memory, maintain mental clarity, and reduce the risk of diseases such as Alzheimer's. But here's the thing. This cleansing does not happen well in just any position. If the head is poorly positioned, if the flow of fluid around the brain is restricted, the system responsible for this cleansing simply doesn't work properly, and over time, these toxins accumulate. The result? Memory starts to fail, forgetfulness increases, and the risk of dementia rises silently. Recently, I saw a patient named Michal, 70 years old, who always slept on his stomach. He complained of mental confusion upon waking, forgot where he had left his keys, and repeated stories. When we simply changed the position in which he slept, his symptoms improved within a few weeks. Without medication, only with information and guidance. Have you ever heard of something like this? That's why understanding what happens in the brain while we sleep is the first step to protecting it. During the day, your brain works tirelessly. It processes thoughts, makes decisions, regulates emotions, and stores memories. But at night, when you sleep, it shifts into a different mode, deep cleaning mode. This function is so important that nature itself created a system to carry it out. The glymphatic system is like a drainage network that removes brain impurities, such as toxic proteins and metabolic waste that naturally build up during the day. Now imagine what happens when you sleep poorly or in the wrong position. This system gets blocked. The brain is not cleaned as it should, and these toxins remain, affecting areas responsible for memory, concentration, and decision-making. One of the most dangerous proteins that builds up when the glymphatic system fails is beta-amyloid. It is directly linked to Alzheimer's disease. And the most alarming part is that MRI studies show that people with interrupted sleep or with poor sleeping positions wake up with more beta-amyloid than when they went to bed. I like to compare it to a river. When the water flows freely, everything is fine. But if something blocks the river, it overflows, and what should be clean turns into a problem. In my clinic, I see this often. Emma, 74 years old, always slept sitting in a chair because of her lower back pain. Over time, she began to experience worrying memory lapses. When we helped her sleep on her side with good spinal support, she was once again able to clearly remember the names of her grandchildren. Sleep is not just rest, it is natural treatment for the brain. But it only works if the position allows the glymphatic system to do its job. It's fascinating to think that while you sleep, your brain performs a true cleansing. And this cleansing is not metaphorical, but physiological, proven by neuroscience. During deep sleep, the brain decreases its electrical activity and blood vessels contract slightly. This allows the cerebrospinal fluid, a clear liquid that circulates through the brain and spinal cord, to penetrate more deeply into brain tissue. This fluid acts like a natural detergent, washing the spaces between neurons and sweeping away waste, toxic proteins, and byproducts that, if allowed to accumulate, damage brain function. This process is silent but vital, and it depends on two things: sleep quality and body position. If you sleep on your back, for example, this fluid may have more difficulty circulating, especially if you snore or have apnea. Sleeping on your stomach can compress important structures. Sleeping on your side, especially the left side, favors brain drainage and optimizes this self-cleaning process. A study published in the journal Science showed through imaging tests that the fluid circulating in the brain increases significantly during certain sleep phases, particularly when the person is lying on their side. It's as if the brain takes advantage of that moment to sweep away everything accumulated during the day. I remember Emily, 69 years old, an active woman who complained of a sensation of mental heaviness upon waking. After adjusting not only her sleep schedule but also her posture, she told me, "Doctor, my head feels lighter." That's what happens when your brain cleans itself properly. You wake up feeling clearer, sharper, more yourself. Many of my patients have never heard of the glymphatic system, and maybe you haven't either, but it's one of the most important discoveries about the brain in modern medicine, especially for those over 60. The glymphatic system works like the brain's sewage system, eliminating toxic waste that builds up in brain cells. Its name comes from the combination of glia, the cells that support the brain, and lymphatic, the body's cleaning system. In other words, it is the system that cleans the brain, working together with glial cells. But there's a problem. As we age, the system becomes slower and less efficient. The flow of fluid that cleans the brain decreases. With it, the risk of accumulating dangerous substances such as beta amyloid and tau proteins increases. These substances are directly linked to the development of neurodegenerative diseases such as Alzheimer's and Parkinson's. And here comes a crucial point. Sleeping position can either help or hinder this system. After age 60, when the body no longer regenerates at the same pace, every detail counts. If lymphatic flow is already reduced due to age and the person still sleeps on their back or stomach, brain drainage can be severely affected. Richard, my 75-year-old patient, is a clear example. He came to me complaining of frequent forgetfulness and mental fatigue. His cognitive test was normal, but he slept sitting up because of reflux. With medical guidance and simple adjustments to his position and the height of his bed, we were able to improve his nighttime posture. Within 2 months, he felt more alert and had a more stable memory. The glymphatic system is silent, but its effectiveness depends on the decisions you make each night when you go to bed. Do you know which position is most harmful for the brain during sleep? Many people believe that sleeping on your back is the most neutral position, but that's not entirely true. And today I want to share with you what happened with Mia, a charming 72-year-old lady. Mia came to my office accompanied by her daughter. She had become more forgetful, repeated questions, and sometimes confused the names of close family members. Nothing severe, but enough to worry her family. Talking with her, I discovered that she had been sleeping strictly on her back with 2 stacked pillows. For more than 30 years it had seemed comfortable to her. She had never questioned that decision. But there was something more. She snored heavily, woke up several times during the night, and felt heavy when getting up. We explained to Mia that sleeping on her back can increase pressure in the airways, favoring snoring and apnea. These breathing interruptions mean the brain receives less oxygen, which directly affects memory and mental clarity. In addition, this position can reduce the flow of the glymphatic system, the system responsible for cleaning the brain while we sleep. I recommended that she try sleeping on her side with a pillow between her knees and good neck support. The first few days were uncomfortable. Of course, changing a decades-long habit is never easy, But after a few weeks, Mia reported that her forgetfulness had decreased. She woke up with more energy and felt more present in conversations with her grandchildren. Sleeping on your back may seem harmless, but it is one of the positions that most interferes with brain oxygenation and nervous system cleansing. It's important to pay attention to how you wake up. If you feel confused, mentally tired, or with the sensation of not having rested, the problem may lie exactly in how you go to bed each night. Many of my patients tell me that sleeping on their back is the most comfortable position. And in fact, for some people, it may indeed feel better for the spine, especially if they have hip or shoulder pain. But when it comes to brain health, comfort is not always the best indicator. Sleeping on your back, also called the supine position, can carry risks many people are unaware of. In this position, the base of the tongue and throat tissues tend to fall backward, especially with the muscle relaxation that occurs during deep sleep. This can partially obstruct the airways, causing intense snoring and even apnea episodes, brief pauses in breathing that interrupt sleep and reduce brain oxygenation. And that's not all. Neuroimaging studies show that when sleeping on the back, cerebrospinal fluid flow, the fluid that cleans the brain, can be less efficient, hindering the elimination of brain toxins such as beta-amyloid. Mr. Joseph, 76 years old, always defended this posture as the most natural. However, he suffered from mental fatigue, forgetfulness, and episodes of irritability upon waking. With a simple sleep test, we detected microarousals caused by mild but frequent snoring. After switching to side sleeping and using a pillow to stabilize his body, Joseph not only slept better, but also reported clear improvement in concentration and memory. Of course, every case is unique. But if you sleep on your back and wake up tired, or if your partner says you snore a lot, it's worth considering the following. Comfort may be hiding a greater risk. Observing your body, adjusting small details, and seeking guidance can all help protect your most precious asset, your mind. Sleeping on your stomach is a position many people adopt since childhood. It seems comfortable and gives a false sense of security. But when we talk about brain circulation and cognitive health, it can actually be one of the worst options. When lying face down, the neck has to be strongly rotated to one side to allow breathing. That means hours with the cervical spine twisted, compressing the vessels that carry blood to the brain. This prolonged rotation can subtly but continuously reduce cerebral blood flow. Over time, it can cause micro-injuries that affect balance, memory, and even emotional stability. I remember the case of Felicity, 67 years old, who had slept with her face to the right every night since her youth. She came to me with morning dizziness and difficulty concentrating. After a postural and vascular evaluation, we identified narrowing of the vertebral artery, worsened by chronic neck twisting during sleep. With physiotherapy and a change of sleeping position, her symptoms improved significantly. Another important point: when you sleep face down, there is direct pressure on the chest and abdomen, which makes diaphragmatic breathing more difficult. This interferes with overall oxygenation and consequently with brain health. Not to mention the strain on the lower back, shoulders, and jaw. Many older adults who sleep on their stomach wake up with headaches, a heavy sensation in the forehead, or neck stiffness, without realizing that their sleeping posture is the cause. So if this is your preferred position, it's worth considering alternatives. The change may seem difficult at first, but the long-term benefits for your brain and overall well-being are immeasurable. Few people associate snoring or breathing pauses during sleep with memory loss, but this connection is both deep and dangerous. Sleep apnea is more common than people think, especially after age 60, and it can drastically affect mental clarity, concentration, and even mood. I want to tell you the story of Anthony, 68 years old, retired, calm, but who had been forgetting simple names, appointments, and even important family dates. His wife mentioned that he snored a lot and sometimes seemed to stop breathing for a few seconds at night. But Anthony insisted he slept well and didn't believe this could be related to his mental confusion. We ordered a sleep test called polysomnography, and the results were clear: moderate apnea. This means that several times per hour, his brain was without oxygen for a few seconds. And each time this happened, the brain had to wake up quickly to regain control of breathing, fragmenting sleep, preventing deep rest, and affecting essential cognitive functions such as recent memory. The good news is that with simple adjustments, such as changing his sleeping position using an appropriate pillow, losing a few pounds, and in some cases using a device called PAP, Anthony regained much of his vitality. Little by little, his memory returned. He himself said, "It's like I became myself again." Sleep apnea is deceptive. Often people don't even know they have it, but its effects can be devastating. If you snore loudly, wake up with a dry mouth, feel drowsy during the day, or have frequent memory lapses, investigating your sleep is just as important as caring for your heart. After so many warnings about the risks of sleeping on your back or stomach, the inevitable question arises. So, what is the best sleeping position to protect the brain? The answer from science is clear, on your side. But then another common question comes from my patients. Doctor, Margaret, which side? Left or right? Let's go step by step. Several studies using neuroimaging and lymphatic flow analysis have shown that sleeping on your side, especially the left side, supports the function of the system that cleans the brain. In this position, cerebrospinal fluid circulates better, helping to remove toxins such as beta amyloid more efficiently. In addition, sleeping on the left side also provides benefits for the digestive and circulatory systems, especially in people with reflux or heart problems. The stomach and pancreas are better positioned, aiding digestion and reducing nighttime discomfort. However, for some people, sleeping on the left side may cause hip or shoulder discomfort. In these cases, sleeping on the right side is also a safe option, as long as the body is well supported with proper pillows between the knees, under the head, and if necessary, behind the back. Mary, 70 years old, was a remarkable example. She suffered from leg swelling and mental fog upon waking. With small changes, such as preferably sleeping on her left side, slightly elevating her legs, and maintaining a good nighttime routine, her sleep quality and clarity improved significantly. There is no perfect position for everyone, but there is one direction proven by science. Sleeping on your side with your body aligned and well supported may be one of the best gifts you can give your brain. Have you ever heard that sleeping on the left side is good for the heart? Well, you should know that it's true. It goes beyond old sayings. Today, science confirms this benefit. And not just for the heart, but also for the brain. Let's understand why. The heart is located slightly to the left of the chest. When you lie on this side, gravity helps venous return. In other words, blood from the legs and other parts of the body flows back to the heart more easily. This more efficient flow contributes to better overall oxygenation, including for the brain. Additionally, sleeping on the left side promotes lymphatic drainage, optimizing brain cleansing during sleep. Studies have shown that this position facilitates cerebrospinal fluid drainage, allowing for more effective removal of toxins linked to brain aging and memory loss. But the benefits don't stop there. This position also improves digestion. The stomach and large intestine are positioned so that the left side facilitates the movement of food and gas, reducing discomfort that could interrupt deep sleep. I recall Brandon, a 73-year-old cardiac patient who suffered from swelling and mental fatigue upon waking. By changing his sleeping position to the left side, with the help of a pillow between the knees, he noticed rapid improvement. He began to sleep better, wake up with more energy, and even his blood pressure became more stable. These details may seem small, but in the body of an older adult, each small improvement can represent a huge change in quality of life. So if you haven't yet tried sleeping on your left side, perhaps it's time to do so. Your heart and brain will thank you. Changing sleeping position may seem simple, but for many older adults, it's not so easy. Back pain, shoulder pain, hip or joint problems make any nighttime adjustment difficult. But the good news is that with small adaptations, it's possible to sleep on your side comfortably and without pain. The first thing I explain to my patients is, the body needs support, not just a mattress. Side sleeping requires your joints to be well aligned, and this only happens when you use your pillows the right way. For example, A pillow between the knees prevents the hips from rotating forward, thus protecting the lower back. Another one under the head should keep the neck aligned with the spine, not too high, not too low. And if you feel you might roll over during the night, place a pillow behind your back for gentle support. Teresa, 75 years old, suffered from hip osteoarthritis and said side sleeping was impossible. But with proper support adjustments, she was able to sleep with less pain and wake up with more energy. With just regular pillows and some guidance, sleeping position stopped being a problem and became part of the treatment. The mattress also matters. Very firm mattresses put pressure on the shoulders and hips, while very soft ones don't support the spine. Ideally, a medium-density mattress adapts to the body and distributes weight evenly. If you feel tingling, pain when turning in bed, or stiffness in the morning, this is a sign that your current position is harming your body and mind. Don't ignore these signals. Adjusting your sleep pattern may be the simplest and most effective step toward living with less pain and more clarity. Many people think that sleeping well simply means lying down and waiting for sleep to come. But especially after age 60, the body needs preparation. Sleeping is like an orchestra tuning its instruments before the concert. This preparation is what we call a nighttime routine, and it makes all the difference in sleep quality and brain protection. The first step is simple. Establish a fixed time to go to bed and wake up. Even on weekends, the brain thrives on predictability. Sleeping and waking at irregular times disrupts the biological rhythm and affects melatonin production, the natural sleep hormone. Another essential tip: turn off screens at least 1 hour before bed. The blue light from phones and TVs inhibits melatonin and keeps the brain alert. Choose warm lighting, gentle reading, or relaxing music instead. Amelia, 71 years old, used to watch TV until she fell asleep on the couch. She would wake up disoriented in the middle of the night. With simple guidelines, such as creating a nighttime ritual, darkening her bedroom, and avoiding caffeine after 5 p.m., she began to sleep better and wake up with a clearer mind. Other habits that help: warm baths before bed relax the body and help lower body temperature, promoting deep sleep. Avoid heavy meals at night. Opt for light, warm foods such as soups, broths, or a relaxing tea. And importantly, regular physical activity during the day improves nighttime sleep, but avoid intense exercise close to bedtime. Your brain needs sleep to recover, reorganize memories, and maintain emotional balance. A good night's sleep begins long before you go to bed. It begins with decisions you make throughout the day. As we age, it's natural for our sleep patterns to change. But many of the problems that arise in old age are not only a consequence of aging, but also of bad habits that accumulate over time. Let's talk about the most common mistakes I see among my patients and how to avoid them. Mistake number 1: sleeping in chairs or on sofas. Although it may seem comfortable at first, this position strains the spine, compresses the chest, and prevents proper circulation. Elvira, 74, slept every day in the living room chair because she said it made breathing easier, but she woke up tired, in pain, and mentally foggy. With simple adjustments to her bed and mattress incline, she returned to sleeping in her bed and felt the difference within a few days. Mistake number 2: keeping the room lit or noisy. Many older adults leave lights on for fear of falling at night, but even dim light can interrupt melatonin production. The solution: motion sensor night lamps installed on the floor that light up only when needed, without disturbing the natural sleep cycle. Mistake number 3: excessive use of sleeping pills. Sedatives and anxiolytics don't promote restorative sleep. They simply shut down the brain without allowing the deep sleep phases necessary for memory consolidation. Instead of medication, seek natural strategies such as acupuncture, guided relaxation, or herbal therapy, always under professional guidance. Mistake number 4: sleeping on your back or stomach without realizing the impact on the brain. As we saw earlier, these positions compromise both breathing and nighttime brain cleansing. If changing is difficult, start gradually using pillows for support until your body adapts. Sleep is as important as food and exercise. Avoiding these mistakes gives your brain the opportunity to age with clarity, energy, and autonomy. Have you ever imagined that a simple daily habit like sleeping well could be one of the most effective ways to prevent neurodegenerative diseases such as Alzheimer's? Science has increasingly confirmed what many doctors have observed in practice. Deep, continuous, high-quality sleep protects the brain against the buildup of toxins that lead to neuronal degeneration. Alzheimer's, for example, is directly associated with the accumulation of a protein called beta amyloid. During deep sleep, especially in the correct position, the lymphatic system removes this protein more efficiently. But when sleep is interrupted or poorly utilized, these toxins remain in the brain and accumulate over the years. It is not an exaggeration to say that each night of poor sleep is a small damage to brain health. And the most alarming part, this damage is silent, develops slowly, and only shows symptoms when it's already advanced. Emily, a 78-year-old patient, came to me with suspected early dementia. Her tests were normal, but her history revealed decades of insomnia, tranquilizer use, and a chaotic nighttime routine. With a joint effort, adjusting her sleeping position, treating mild apnea, and retraining her sleep, we achieved significant improvement. Today, she feels more alert, speaks more clearly, and has returned to doing crosswords, something she had neglected. The brain, even as it ages, still responds to care. Sleeping well, in the correct position, in the right environment, and without disturbances, is one of the most accessible and powerful ways to preserve the mind. Prevention starts with the pillow. Sleeping well is much more than simply resting the body. It's a way to protect your brain, preserve your memory, and ensure more years of clarity and independence. Throughout this video, you learned that your sleeping position directly affects brain cleansing, cerebral oxygenation, and even the prevention of diseases such as Alzheimer's. We discussed the risks of sleeping on your back or stomach, the benefits of side sleeping, especially on the left side, and how to adapt your position even with pain or physical limitations. You also heard real stories of people like you who transformed their health simply by adjusting how they sleep. Now it's your turn. Observe your sleeping posture. Make adjustments. Maintain your nighttime routine. Small changes can have a big, profound impact on your mind, memory, and daily well-being. I am Dr. Margaret Ellis, a physician specializing in senior health. If you found this content helpful, comment below about how you usually sleep and whether you plan to make changes starting today. Like the video, share it with someone in your family, and subscribe to the channel to receive serious and practical guidance on aging with health and dignity. Sleep well, take care of your mind, and see you in the next video.